Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I analyze the latest outbreaks occurring in the United States and around the world and give you expert insights on infectious diseases and public health. And this is our weekly episode called Inside Outbreaks. And on these episodes, I review the outbreaks that you need to know about. And I do this with my friend and colleague, Dr. Jon Epstein, a veterinarian, virologist, and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, Jon, for joining me today.
Hi, Jay. It's good to see you.
Yes, it is good to see you. And I know you and I like to try to keep things light, but I think, both of us are
Do we ever succeed at that?
Yeah, exactly. Not very much. We'll get there eventually.
Yeah.
But obviously, you and I have been struggling a bit with what's happened over the weekend. And just to bring people up to date, since actually this isn't getting quite as much coverage as I thought there might be, a man who believed that vaccines were causing him health problems took guns and weapons to the CDC campus on Friday afternoon and fired something like over 180 rounds at CDC. Unfortunately, one person did die. It was a police officer, Officer Rose, who was the first responder to the incident, who it must be noted, died trying to save the lives of the employees at CDC. There's a daycare center that a lot of my friends and colleagues have used before, trying to save their children. So this officer bravely put themselves on the line and died. And I think what you and I struggle with is that the people in those buildings who are being shot at are also putting their lives on the line.
Yes.
People like you and me who have spent years trying to protect people from dangerous, deadly diseases. And now we are specifically being targeted and have been targeted for several years. So, Jon, I'm curious kind of what your thoughts have been like since you got this news on Friday.
Yeah, Jay, I mean, you and I have, different connections to CDC, but I'm sure what we share in common is huge respect for the people who work there and the institution itself. And to me, this is just unconscionable. I spent some time there many years ago, rotating through the rabies division, actually. And then I've continued to work with various colleagues at CDC throughout my career, and just some of the best, most dedicated people. But again, this shooting is a symptom of some of the horrific misinformation that's being put out there. This person was obviously, was mentally ill, but had access to weapons and decided to take out his frustrations. And I believe it was the COVID vaccine that he was particularly blaming for his physical illnesses, and took his frustrations out on the CDC in a way that, was fatal. And that officer is a hero for trying to protect people. So this is a horrible symptom of, I think, a boiling point that society is reaching with its mistrust of science and public health, mistrust of government, and taking matters into their own hands to express that frustration. And so it just saddens me to have colleagues who had to, deal with this.
Yeah, I wrote an essay for this over the weekend. I really didn't know what to think. I'm in a bunch of different fora where I can sort of privately exchange messages with colleagues of mine, some of whom are still at CDC, some of whom are gone, and was trying to process everything. And interestingly enough, the emotion that kept coming up was neither grief nor surprise. I was numb to the whole thing and frankly just wondering where the next violent attack is going to be. And so what I wrote so on Sunday morning, I was actually away for the weekend with my wife. We were supposed to be relaxing, and I sort of got up and in about an hour just sort of frantically wrote this essay because I had to get these feelings out of my mind. And I was reflecting on the fact that, I personally and many colleagues I know have been receiving, violent threats since COVID emerged, and many of us incidentally became public figures in this response. And those death threats haven't gone away. I got one in June that I didn't tell a lot of people about because I didn't know what I was supposed to do about it. And so I wasn't surprised that with all of the misinformation and frankly horrifically fraudulent and dangerous information coming out of officials in the US government, that this was bound to happen. Everything from saying that COVID was created by US government scientists to the vaccine that over 200 million Americans received is dangerous and deadly and needs to be taken off the market. These are things now coming out of official channels,
Yeah.
and they have the effect of making people appropriately who hear and believe them angry. And unfortunately, in a society where guns are prevalent, are going to take those and then attack the people who have dedicated their lives to this. And kind of what I wrote in my essay is that those of us in public health have really been faced since 2020 with essentially three choices. The message that went to my colleagues as part of active shooter drills, was to run, hide, or fight. And many people have run from public health. There's, even before the recent cuts that occurred, there were 20 to 30% vacancies. A lot of public health officials have left. Almost every health official of a county in California left sometime after the peak of COVID. Others I know were chosen to hide. They simply don't talk about the work that they do and try to disguise what they do because they're afraid of being attacked in a community setting where they may be talking about vaccines. And finally, I think there's the desire to fight. And I think you and I are in a somewhat privileged position in that we're outside of government. We have some platforms and trust. And I think it is important for a lot of us who have the opportunity to be out there speaking about science and public health, and also explaining the challenges of this, and that these aren't cut and dry decisions that people make without empathy. They're decisions that we make about the health of other people based on our desire to help people live healthier, longer lives. And we can disagree, but we need to do that, civilly and politely.
Yeah, Jay, I think, this speaks to one of the big issues that I'm grappling with and thinking about is how did we get here where there's so much broken trust with society? And the COVID pandemic was, I think in the public health community, we all hoped it would be a galvanizing moment, that it would be almost like a 9/11 moment where everyone came together around fighting the pandemic. But in a lot of ways, it backfired. In a lot of ways, it didn't go well. It created a lot of frustration and resentment. And understandably, a lot of a lot of folks in society suffered from the restrictions that were placed on their businesses, on their personal lives, on family. It was really difficult. And so there was the result was this fracture of trust and a mounting anger and frustration. And I think we're suffering from that now. And we have to find ways to make sure this doesn't happen again, and to restore that trust. And again, this wasn't a hardened criminal who started firing on CDC. This was a person mentally ill and unstable, but somebody who just, their understanding was that they took a vaccine and it caused problems, and they're angry at the people who created and authorized and even mandated the use of vaccines. So we have to get back to restoring that trust. We have to talk about science in a broader way with society, probably starting at a really young age, to understand the process of how we make medicine, how we make vaccines, how it's decided that vaccines are safe and effective. And then we need a government that doesn't remove the expertise, the technical expertise from the institutions who are reviewing safety and efficacy for the drugs and vaccines we depend on.
Yeah, you're absolutely right. I mean, these are, and I think many of us in health and science need to accept the fact that these changes, that if we want them to happen, are going to take a tremendous amount of work.
Yeah.
Number one. Number two, they're going to probably take decades. As we all know, there's that famous saying, it takes, 20 years to build a reputation and 2 minutes to destroy it. We've now been through those 2 minutes, right? And so it's going to take a long time. And the third is, and this is, I think, the point, and I think one of the reasons you and I have this YouTube channel and do a lot of public speaking is, it's not going to happen without community organizing and community involvement. And people like you and me and all of our many friends and colleagues who work in public health, we need to get away from our desks in some way and be out there talking to people in town hall meetings and community groups. It could be on social media as well, doing something to tell these stories and make it clear that we are humans that are trying the best we can to help and improve the lives of people. And we can disagree sometimes vehemently about data or methods or policy choices, but we need to be able to do that within the understanding that we all share common values about trying to build a productive and just and economically successful society.
Yeah, absolutely. And on the communication front, and I just want to take a moment, Jay, to give a shout out to a new friend and colleague, Brenda Adakari, who's a producer who created a podcast called Why Should I Trust You, where she's really diving deep and exploring some of the sincere differences and questions between the public health community and folks in the MAHA movement. And she's been doing a really great job setting up these town hall conversations with public health scientists and officials and members of the MAHA community to really listen and talk and understand concerns and try to address them. And I'm really appreciative of this effort, which is why I'm mentioning it. So if folks are interested in hearing more about efforts to bridge those gaps and reach out to different communities to really try to help repair and heal, check out this podcast, Why Should I Trust You? I think they're doing a terrific job.
Yeah, we'll make sure to put a link into our notes as well too. So, and I think that actually brings us, interestingly enough, to the first topic, which is to bring people an update about the Legionnaires Disease outbreak in Harlem. And the reason I want to say that is because actually I had a very important moment in my public health career was back in 2015, when there was the largest outbreak in New York City history of Legionnaires disease. Hundreds of people got sick, and many people unfortunately died when a big outbreak occurred in the South Bronx due to a cooling tower that was not appropriately maintained. And that cooling tower had Legionnaires bacteria in it that were spread out into the community, into the air. And I remember the first town hall meeting that I went to. I went with my boss, Commissioner Mary Bassett at the time, and really hearing the anger. And I'll say that it's appropriate anger. I want to emphasize this isn't bad anger from the people in that community about this outbreak. And what I absorbed and understood, and what I had also learned in some training I'd been through in communications, was I could feel that their anger wasn't about this outbreak per se. It was about a sense of injustice, right? And it was about a sense that nobody was actually taking care of them. And this was just one straw on top of another, 1,000 straws that were there that now weighs a ton, right? And so trying to really absorb and understand that while people were expressing their anger and often expressing it directly at me and at my boss, the commissioner, it wasn't the two of us that they were actually angry at. What they were angry about was a system of injustice that had been created there. And so I wanted to start with that because I think that relates to your point about like listening to these conversations and understanding what people are really upset about. And it is distressing to find out that this outbreak has grown. And now we talked a bit about last week about why that might happen, right? The incubation period of this is long. And so even if you stop it at its source, it will have already infected people, and those people eventually get sick. So now it looks like we're up to 90 confirmed cases and 3 who have died. And there's still currently 17 people who are hospitalized. And it's the largest outbreak since that one that I just referenced, the one since 2015.
Yeah, and it's interesting because there's a lot of factors that lead to the ongoing, the prolonged outbreak duration. And so protocols are in place to clean up these water cooling towers, to remove biofilms, and to disinfect. But how well those are implemented, whether there's resources in city health department or other agencies that are involved in the cleanup process, and how quickly they get to it, all impact the length and duration and magnitude of this outbreak. So even though the mitigation factors are clear, how quickly they can get to them and how effectively matter. And so I think, some of that is there are probably still water cooling towers that are putting out mist or water droplets, right, that have Legionella in them.
Yeah, and this is actually a real concern, right? So what ended up happening was because of that outbreak, it became clear that there are probably a number of factors leading to an increase in the number of Legionnaires disease outbreaks. One of them very clearly is recognition, right? There are diagnostic tests.
Yep.
We make providers much more aware of it in New York City. The second was the incredible density and prevalence of these cooling towers in a city like New York. And the third are probably factors related to climate change that are altering the way in which bacteria can develop and build on these biofilms. So what's the answer to that? So the answer to a lot of these things, unfortunately or fortunately, depending on how you look at government, is to regulate, right? To create a set of common rules so that we can all be collectively safe. So what came out of that outbreak was work that I, had done in collaboration mostly with the work of my colleagues in environmental health at the city health department. Dan Cass, who was our deputy commissioner at the time, really led that effort, along with our water safety experts, developed the first kind of national or first standards for maintaining the cleanliness of cooling towers and inspecting them for Legionella. But it turns out, COVID disrupted a lot about our public health systems and approach. And what you see on this graph, and this is one that I took from Gothamist, which is a news site and blog here in New York City, that after 2015, where this inspection program was put in place, and you saw a dramatic drop off in Legionnaires disease outbreaks, there were far fewer. The clusters that occurred were always much smaller, far less deadlier. But of course, there was what you're seeing right here is a chart of the number of cooling towers inspected year after year. And what you saw is this very high peak in 2017, and then a big drop off during COVID. Obviously, workers were doing other things. It rebounded in 2022 as the pandemic was moving down from its peak. But what you've seen over the past years is that the number of inspections has not gone up to what it should be, despite there being just as many buildings, if not more, than there were before the pandemic. And I think we can all understand how this happened, right? Government is not investing in public health the way it used to. There's been this real push to pull back funding from public health as opposed to the 9/11 moment we wanted. And, my fear, and I think it's probably a very real suspicion, is that the lack of inspections led to fewer buildings maintaining their cooling towers the way they used to, and may very well be a proximate cause for why we have the second biggest outbreak and the biggest outbreak since that legislation was put in place in 2015, 2016.
Yeah. So, maintenance is going to be a real challenge. I did read something really interesting that a few years ago, this is actually back from 2019, Health and Hospitals, New York City hospital system, changed their water cooling tower structures, the way that they were built, in a couple of ways to help reduce the chance of biofilms and bacteria growing. And a couple of measures are really interesting. One is they changed the shape from box-like to round tanks that were holding the water. So there were less corners where water tends to stagnate and where biofilms have a better chance of accumulating. The second thing they did was they coated the interior of the tanks with an antibacterial, antimicrobial resin, which would reduce bacterial growth in the water kind of continuously. And those two things have really, I think, helped reduce the chance of biofilm and Legionella, growing on those systems. So I know it's expensive, and most buildings probably don't have the resources to totally repair or replace their systems. But for those that are coming out of date and that need replacement anyway, there are new designs that can help reduce the chances. So over time, it'd be great to see water cooling tower designs change to also reduce the chance for something like Legionella growing there.
Yeah, no, that's a great point, John, and I'm glad you found that and highlighted that, because what we consider engineering solutions to public health are really, really important. And in fact, when you look at sort of the hierarchy of public health interventions that have the biggest impact, it's the things that humans don't need to think about and don't need to seek out. So even more important than vaccines, because with vaccines, somebody has to actively visit a healthcare provider or actively accept to get an injection. When you have engineering solutions, like the water coming out of your tap is clean without you thinking about it, your waste, your feces is separated from your drinking and food supplies simply because the system is designed to pump it into a different way. Those are the best solutions. The same thing is true in hospitals where you have, or any facility where you need to improve indoor air. Having an engineering system that cleans the air is important. So yeah, I would love to see that if there is, and I know there's a huge amount of concern about, putting more regulation on businesses and things, but these are the types of solutions that once they're in place can really protect people's health without anybody having to think about it.
Yeah.
So John, now we're going to move on to a different topic. And this is more in your area, but I've been, concerned and fascinated and disturbed, I guess all of those three things together, about a couple of reports from California. So I think about 2 weeks ago, we had a whole discussion, or maybe it was last week, we had a whole discussion about Florida and dangers in Florida related to shellfish and related to bugs. So now it's our time to be, fair. And
We're going
also
to go after the other coast.
exactly, is to go after the other coast. And so we're not safe, there's safety and challenges everywhere you go. So let's turn to California. Okay.
Yes.
In California and Florida, there's a lot of political fighting, obviously, between leadership in both sides. But what's going on in California? Dogs are dying in Los Angeles, and
Yes.
sea lions are dying in San Francisco. So, Jon, take me through this. Why are the dogs dying in LA? Why are sea lions dying in San Francisco? And let's go through one at a time. What's going on
Right.
here?
Okay. So let's start with Los Angeles. So this is
Yeah.
a case where, in the Venice canals, where there are areas of standing water, people have been walking their dogs in these areas, and then their dogs have fallen sick with severe GI symptoms and neurologic symptoms. So vomiting, diarrhea, tremors, seizure. And there have been about 26 cases so far of dogs getting ill, and there have been 5 deaths. And so this is obviously very upsetting to pet owners, and it's a pattern. And so whenever we see patterns of illness and death, we think about either an infectious disease outbreak or a common source of exposure to something that is making these dogs ill. And in this case, the suspicion is that the warm standing water is promoting algal growth, algae that's producing biotoxins. And there are different kinds of biotoxins that algae can produce. But when you get warm water and an overgrowth of algae, and then animals, whether it's wildlife or pets, come in and get exposed to this by drinking the water, or maybe get it on their fur and then lick their fur, they can ingest some of these biotoxins, and the results can be fatal. And I think that is what we suspect is happening with this cluster of cases of dogs in LA.
Yeah, and this is, obviously incredibly concerning. I don't own a dog, but many of my friends that love dogs and consider them to be family members, and particularly in a place like Venice Beach, where people are out walking all the time. People are walking and running. I've been to that area many times. I have 2 kids that live in Los Angeles. I've got family that's connected there, so this is a real problem. I mean, one of the beauties of living in Southern California is the ability to spend a lot of time outdoors and to walk along boardwalks and be there with your pet. So what should people be doing to keep their dogs and other pets safe right now, you think?
Yeah. And of course, there's nothing you can do to know in advance necessarily that, puddles of water or standing water do or don't have toxins in them, but it's something to generally be aware of, that when you are out walking your pets, any standing water, especially water that's exposed to sunlight that might be warming up, has the potential to have bacteria, or in this case, algae that with toxins. You just want to keep your pets away from puddles. And when we talk about the next story, it's going to be relevant to this as well. But general thing is stay away from frothy or foamy, discolored water. Certainly, if you happen to observe other dead animals around it, I think in this case, there might have been a dead bird, a duck, or something that was in the vicinity as well. That's an indication that the water may not be healthy and that wildlife are getting sick and dying. So that should be a very big red flag to have your pets avoid getting into that water. If your pets get splashed with the water, you may want to towel them off and wash them with gentle detergent and water, just to clear their fur of any contamination from toxins that may be in there. And then, of course, don't let them eat any dead animals around that area. If you have the type of dog that will pick up dead rodents or dead animals and munch on them, you definitely want to avoid that, because if that animal died from the toxin, it would certainly affect your pet as well. And if you see any signs of illness in your animal, severe gastrointestinal distress, vomiting, diarrhea, if they start shaking uncontrollably, or even if they start to have seizures, that you need to get them to a vet right away to be looked at, and mention that they've been walking in an area where you think there was some standing water, particularly if you're in the LA canal area, the Venice Canal area.
Yeah. Do you know if there's any treatment available? I have to assume maybe there isn't, and that's why so many dogs have died related to this.
Yeah, it's hard, because when the toxin is in their system, gets into their blood, and it's already causing severe illness, it's really supportive care at that point. They have to get into a hospital, probably be put on fluids and supportive care to try to get them through this. But if they've ingested it and it's gotten into their bloodstream, at that point, it's really supportive care to treat this. There isn't any treatment per se, and so the best thing to do is to avoid exposure to toxins.
All right. So if you have a dog and you live in Los Angeles, keep in mind that you need to be careful about the water sources that they're walking near and the water sources that they're touching. And hopefully we'll get some updates on this and find out, whether or not there's been some resolution to this issue, particularly affecting the Venice Canal part of Los Angeles. So now let's shift to sea lions, the second part of our discussion about risks to animals in California. So, Jon, what's going on in San Francisco? So this is not a toxin. This is due to a bacterial disease outbreak, right?
That's right, leptospirosis. This is a bacteria that traditionally we think of as being carried by rodents, but it can really be carried by a lot of different animals, and it affects the urinary tract. So it tends to infect kidneys, and it gets shed in the urine. So infected rodents that can carry leptospirosis, when their urine contaminates water, again, this is where standing water comes into play. But when water is contaminated by rodent urine that has leptospira bacteria in it, and then a dog or a cat comes around and drinks from that puddle, they can get infected by this bacteria. And although it targets different organ systems, we generally see kidney disease as one of the major outcomes from infection with leptospira. And the good news is this one is treatable by antibiotics. And even better news is there's a vaccine for your pets to protect them against leptospirosis. What we're talking about in this story is that we also see leptospirosis outbreaks in wildlife, and particularly California sea lions. We have historically seen outbreaks of leptospirosis that does cause illness and mortality in sea lions, and this comes in periodic waves every 4 or 5 years or so. And we've known about this for decades, since the 70s, where we see these outbreaks in sea lions. Where there's crossover, where this can impact our pets, is that sea lions come onto shore to bask in the sun. So when they get on the beach, if they are infected and they're contaminating standing water with urine, it also presents a potential risk for pets that get exposed to this, or even people. People can get leptospirosis when they're swimming in stagnant water or standing water. The bacteria can also get into our body through mucosal membranes if we have abrasions on our skin. And so, ingestion's the primary way, but there's other ways to get exposed. So it's also a caution for people who like to swim in ponds and creeks and, slow moving or standing water, that's a potential risk depending on whether there's contamination from infected wildlife or other animals.
Yeah, in humans, most of the outbreaks that we have associated with leptospirosis tend to be associated with outdoor recreation, and not so much, seawater sources, but freshwater sources. When I was at CDC, we would often hear about outbreaks associated with people going rafting, people on camping trips, and things like that. So, I was surprised to hear that this could be associated with animals that are in salty water as well.
Yeah, so there's a lot of different wildlife species that have been found to carry leptospirosis. And again, this is like a wide ranging category of bacteria, but we've seen it in other terrestrial carnivores like fox and skunk. We see it in sea lions. Occasionally, bats have been found to have leptospirosis. So there's different varieties of this bacteria that can infect different wildlife. And so here we have marine mammals that get infected and can be carriers, actually. They can carry this bacteria. And then when, whether it's due to temperature, environmental change, or just the timing of enough individuals being infected, we get little outbreaks in populations of sea lions. We tend to see mortality from this. And again, it comes in waves. So it's something that's fairly common. And again, how this is relevant to us and our pets is we really need to think about when we're walking our dog, when we're camping, when we're, have our pets out, is to avoid standing puddles and standing water that are higher risk for exposure to leptospirosis.
Yeah, and I think bringing this back to this topic of the dogs, and dogs being at very high risk in Los Angeles right now from the potential contamination of the Venice Canal. It turns out the dogs are especially vulnerable to leptospirosis if they come into contact with a sick or a dead sea lion. So if you're out walking your dog along the beach and anywhere from in Monterey, Santa Cruz, Marin, Sonoma, San Mateo, San Francisco counties, public health authorities are really recommending that you keep your dogs on a leash. You stay at least 150 feet away from any sea lions, and also consider getting your pets vaccinated. So, Jon, is there a vaccine available?
There is, and that's the main point. And I want to be really clear about this. Leptospirosis exists throughout the United States, so it's definitely not a California only thing. We're talking about an outbreak in sea lions. And I think it's good to highlight that, wildlife are susceptible to some of these same things. And there's risk of transmission between domestic animals and wildlife. But the big news, the big important thing to understand is, rodents are generally considered a reservoir for leptospira bacteria. So wherever you live, there is a vaccine for leptospirosis that you can get for your dog. And it is a good idea, because if you're out walking them and they happen to get into a puddle, if they're out of your sight, if they're tromping through the woods, this is going to protect them from infection that could be fatal if they're not protected.
All right, Jon. And on that note, it's a good idea for all of us to take good care of our pets and follow the best advice we possibly can. And obviously take care of ourselves as well, too. And one of the ways we can take care of yourselves and people in your community is to please hit the like button. Please subscribe to our news channel. Please share this with other people in your life that are interested in trying to find ways to stay healthy, understand both the good things out there in the world, as well as the risks as well, too.
Yeah, and Jay,
Jon,
I want to add, if people have questions about anything we're talking about, please leave us comments. We do look at the comments section. If there's a topic you'd like us to cover, if there's something going on in the world that you're curious about, let us know, and we'll be happy to talk about it.
Yeah, please drop anything you can into the comment section. That engagement helps us reach more people, and it obviously helps us do a better job of serving all of you out there. And so with that, we're going to close our episode this week and look forward to seeing you next week for another episode of Inside Outbreaks.
Be well.